Good evening, everyone. Thank you so much for joining the Westchester County Youth Bureau's Town Hall. This is a very important town hall, and we have some really special guests with us this evening to talk about how we prepare for summer and ensure that our young people are safe and well, and that we are aware of just some of the medical professions' perspectives regarding COVID-19 and the multi-system inflammatory syndrome, amongst other things. We are very proud that Westchester County has opened up and that for the most part, we are thriving, we are doing well, and we are ready to go. But we want to ensure that you as the participant and the greater public are aware, just so that we can minimize the spread of any COVID-19 related illnesses and keep our children safe. So with that said, I'd like to first say we have a great team with us tonight, the Westchester County Youth Bureau's team, who has worked tirelessly to provide a number of professional development and trainings during our COVID-19 experience. We also have a dynamic moderator who is no stranger to the Facebook Live platform, and our experts who come from such a diverse background, but mostly infectious diseases, and many are pediatricians as well. But I'd like to first introduce our fearless leader, who I have to say I'm so privileged to work for and appreciate as a county executive within Westchester. As a resident, I couldn't be happier. As a taxpayer, I couldn't be happier despite the economic challenges that we face going forward. But always places our young people, our children, as all residents first. And so without further ado, I'd like to introduce Mr. George Latimer.
Well, thank you very much, Damia. It's a pleasure to be with you all here, and I'm just going to give a few words of welcome, and then you'll get into the meat of the evening tonight. As you have these discussions, I think not of myself and my role and my responsibilities in government, but I think of myself as a father and now a grandfather, and the concerns that I have over the health when my daughter was little, and now with my grandchildren being little. They're not in this county, but we're all concerned about our kids, and those of us who have responsibility for them have to try to make as intelligent a set of decisions as we can, right up to those of us who are in government who are making decisions that affects everybody's lives across the board. I grew up as a young child in Mount Vernon, and right here in this county and in one of the urban centers of the county. And I recognize there are a lot of issues out there, a lot of pressures. Growing up in one part of the county is not necessarily like growing up in another part of the county. So it's our task to try to figure out what are the best strategies and how do we implement them. Really just very simple. The number of cases of COVID have dropped fairly dramatically in the last 2 months. We all saw our first incidents of COVID the first couple of days of March. And by the end of March, the beginning of April, we were reaching our peak, the famous bell curve that we all saw Dr. Fauci and others talk about. And at our peak, we were seeing, a tremendous impact in the county, 1,200 people hospitalized for COVID. We saw overnight fatality rates that numbered anywhere from 40 to 75 people that we lost in a given night at the peak, where we had circumstances and concerns about active cases that were over 10, 11,000 active cases, people who had tested positive but hadn't cleared the 2-week period of time. Now, as we are entering the last third of June, the numbers have dropped dramatically. We're roughly on a par of where we were around March 19th as the curve was rising. Now we're on the backside of the curve falling. But, we're not medical scientists. We don't know what a second wave would look like, when it might come. We don't know if what we're seeing around the country will bounce back to us as people travel in and out of the New York metropolitan area. What we do know, first of all, is that we have a shared interest in keeping children, young people as safe as possible while we open up the summer programs. And we in the county have made a number of decisions over the course of the last 2 months. And then with every decision was a bit of a calculated sense of risk. We opened up recreational facilities like Bicycle Sundays. In fact, we extended it. We opened up golf courses, and now we've opened up beaches, and we're on the verge of opening up pools. But in every one of those cases, we have to be very careful about what our protocol is, because we don't want to spread the infection. And that's the tightrope line that we're all walking. We want to have more of a normal life. At the same time, we don't want to do things that will spread the contagion back to the levels that we saw before. We've opened to phase 2 right now in Westchester County. A week from today, a week from yesterday, we'll be in phase 3, which will open up more aspects of it. And it's enjoyable. I got a haircut. That was a wonderful thing. I was able to go to a religious service at my church in my home community. I was able to dine outside more than once at an outside restaurant, things that we haven't done for 3 months. But we have to be very concerned about where we go forward. And that's part of what the discussion tonight is to try to make those intelligent decisions. We're going to be opening some day camps in the county. We're going to have some drive-in movies for young people and some other things, and try to make it interesting. And all of us are going to be trying to figure out what is that balance? How do we walk that tightrope? I think I want to be sure that we express appreciation to all of the physicians, the parent organizations, the youth service providers for participating in the various informational sessions that have been had about safety for the children. Many of those people bring their expertise to those of us who don't share that expertise. And so we look for that guidance because we want to be responsible adults. We want to protect our kids. And we know that our kids are going to be pushing at the edge. They're going to want to enjoy the outdoors. We're right now in the end of graduation season for high school. What a wonderful time it is, except if you're going through a COVID epidemic. So long story short, I appreciate very much the hard work of Dr. Harris Madden, the team that she has together at the Youth Bureau, all of our various professionals in mental health, in public health, and all the other departments of county government. I get far too much credit for the good things that happen, and I probably deserve more of the blame for the bad things that happen. But nonetheless, we are a team of people. We want to do the very best job we can, and we think that's what the people of Westchester are counting on us to do. So tonight, we'll discuss, hopefully have some insights, and out of the process, we'll all learn more and we'll all get a little bit better. And Damia will come to me as she usually does with a sweet smile and the tone that I had better darn well do this if I want to help the young people of this county, because there is no stronger advocate for the young people of this county than Damia Harris Madden. So Dr. Harris Madden, and to Cheryl Brannon, my friend who's going to be the MC, have a wonderful program tonight. Thanks for letting me be a part of it.
Thank you.
George, thank you so much for those kind words. I'd be remiss if I did not mention our partners with the Department of Health, who Dr. Amler has been instrumental along with Dr. Hewlett, but also we have Sheila Nolan, who you may know as the Chief Pediatric Infectious Diseases from Maria Ferreri Hospital, joining us. We also have Dr. McGowan, who is the owner of Village Pediatric Group in Tuckahoe. She's a pediatrician there. And we also have Dr. Nevins, who is a proud member of my sister organization for Jack and Jill of America, but also is the OBGYN in various capacities. She works with Aetna, CVS, and Montefiore as well. So we have a great lineup tonight. We thank you so much. We know you have a very busy schedule, but you always make time for the Youth Bureau and our parents and our children. So we thank you again for stopping by.
Thank you and have a great evening.
Have a good night. So at this time, I'd like to introduce Cheryl Brannon, who has been one of our key stakeholders and shares an interest in terms of the health of our young people, our women, our children within Westchester community, and has spent decades on the front lines, fighting to ensure health as well as to address the health inequities within our communities. And she is a key person for us in the Youth Bureau. We look to Cheryl for her insights, and she has worked very closely with our team and has agreed to be the MC for this because she's done a lot of research regarding the health and welfare of children and youth. And so without further ado, I'd like to introduce Mrs. Cheryl Brannon, and Cheryl will take it away. Thank you.
Great. Thank you so much, Dr. Damia Harris Madden, and certainly congratulations to our county executive and his wonderful leadership. And also, it's certainly a pleasure to work with you. And you're the one that actually came up with this idea. It's your brainchild. So certainly we are well on our way to a great evening. And thank you so much for that introduction. And those of you out there in WebEx land may be wondering, well, how is this evening going to unfold? Well, I can tell you we have a dynamic group of presenters, and we're going to touch on a number of subjects that are going to give you a wonderful background on this subject and make you much more knowledgeable, certainly by the end of the WebEx. So that said, let me just tell you that beginning, you are going to receive an overview of the impact on the pediatric population, COVID-19, and the pediatric population here in Westchester County. What are the demographics? Then we're going to move right on, and our second topic is going to be COVID-19 and what's its impact on mothers and newborns. So that will give you another perspective. And then we're going to continue on our journey this evening, and you're going to get an update on the role of the pediatrician. And you're going to hear specifically about diagnosis and treatment. The pediatrician is the first line of support. And then, of course, we have the role of the tertiary care, and that's the third line. And here we're going to talk a little bit about children that are very sick, and what do we do to help bring them along the COVID-19 spectrum back to good health. So we're going to certainly delve into that. And then, of course, we are going to wrap up with the Westchester County Department of Health honing in on prevention and the spread of COVID-19. You'll want to hear about the camps opening and things of that nature. So we have a great panel, wonderful topics, and I'm sure you'll get a lot out of the discussion. So that said, we want to dive right in, and I think somebody needs to mute their phone. If you're not speaking, we're going to ask you to mute yourself, because I'm hearing a little bit of background. Thank you so very much. So that said, we're going to dive with our first presenter, and certainly if we could move to our next slide, that would be marvelous. And our first presenter is none other than Dr. Dial Hewlett Jr. He's a medical doctor, and he's also with the Westchester County Department of Health. We're starting with the Westchester County Department of Health, and we're going to wrap up with the Westchester County Department of Health. He's with the Division of Disease Control, and he's also not only a medical professional, but he's in academia. He is, in fact, the adjunct associate professor of microbiology and immunology at the New York Medical College. So very, very well versed on the topic. And without any further ado, he's going to give us the overview, sort of set the stage for COVID-19 here in Westchester County. Dr. Hewlett, you have the floor.
Thank you very much, and good evening to everyone. I'm going to provide, as Cheryl said, an overview of this topic and how this is impacting the pediatric population. Now, most commonly, COVID-19 causes a relatively mild illness in children, and often children infected with COVID-19 are asymptomatic. And during the early phases of this illness, and at the beginning of this, many people thought that children were not going to be severely impacted at all. We found out, however, in early April that that was not the case. And children with severe symptoms often present more than 4 weeks following documented exposures. Adults most often present within a few days of exposure. And in adults, respiratory symptoms are usually most likely to occur in the most prominent part of illness, but that's uncommon in children. Here in Westchester County, there have been over 1,300 cases of COVID-19 reported in children. And the recently described multi-system inflammatory syndrome, or MIS-C as we call it, is a severe complication of COVID in children. And later in this presentation, Dr. Nolan is going to go into greater detail about this. Now, as of the beginning of this month, there were 32 cases treated here in Westchester. That number is now up to about 36. Most of the children who have presented with this syndrome here in Westchester were critically ill, and they required treatment in the pediatric ICU. And most of the children recovered. However, we did experience, unfortunately, one fatality. We go to the next slide. Now, a little bit on the demographics. The age range of the children here in Westchester has been between 6 weeks of age and 19 years. The median age is 7.3 years. There is a male predominance of 70%. In terms of the ethnicity, roughly 30% were white, approximately 20% were Black or African American, about 37% were Latinx or Hispanic, and 13% were Asian. Fever was present in all of the cases, and that's one of the things that's very important for us to think about. And certainly if we have children who have fever for a prolonged period of time, that is certainly an important signal. Abdominal pain and gastrointestinal symptoms were present in 57%, and that is also a very prominent part of this illness in children. A rash was present in 40%, and neurologic symptoms, including things like headache and sometimes other types of neurologic symptoms, were present in 23%, respiratory symptoms in only 13%. An interesting thing here is that a positive test for COVID-19, either via the PCR or the antibody test, was present in about 60% of the children. However, in the remainder of the children, there was no evidence for the infection. And so we'll close with that, and I will turn things back over to Cheryl as we go to the next portion of our discussion.
Excellent. Thank you so much, Hewlett. I'd like, if you would, before we actually transition over to the next speaker, a couple of things I found very certainly impactful. Males are impacted certainly by COVID 70% versus females at 30%, as well as the Hispanic population were at the top 7%. I'm wondering if you might elaborate on those statistics a bit.
Yes, sure. We don't really know why males predominate. Early on, there was a lot of talk about a condition called Kawasaki's disease, which will be discussed later on. But there's a male predominance for that particular syndrome, but we don't really know a lot about it at this time in terms of why males predominate. With regard to the ethnic breakdown, a lot of this may be due to the fact that if we look at where the children lived, more than 50% of the children in Westchester were from 4 towns, that is Yonkers, New Rochelle, White Plains, and Mount Vernon. And maybe that this is more of a reflection of the demographics of the towns where people live. However, we do know that crowded living conditions, and some of the children did live in multi-family dwellings and multi-generational households. And some of these children were in households where the parents, one or both of the parents, were working as first-line workers. And we know that there is probably well, not probably, but definitely an overrepresentation of workers in the first lines occupations in the New York area. And this may be part of the explanation as well.
Okay, great. Thank you so very much. I live in Yonkers has been ground zero, certainly for COVID. So thank you again for elaborating. We're going to move speaker, and now we're going to have the opportunity to hear what mother and the newborn have experienced, certainly as it relates to COVID-19 from an obstetric and gynecology, spit it out, standpoint. And that will be from none other than Dr. Juliet M. Nevins. And she is with the Montefiore St. Luke's, Cornwall. She's also the Clinical Solutions Medical Director at Aetna, a CVS health company. And she was also especially invited by Dr. Damia Harris Madden because she's the chair of the health committee of Jack and Jill of America Incorporated, Mid-Hudson Valley chapter. So it's our pleasure to have with us certainly Dr. Nevins. And Dr. Nevins, you have the floor.
Thank you again for this gracious invitation. It is certainly my honor to be among such esteemed presenters. And with that, I'll jump right in. I do like to just level set what we know with respect to SARS, and then explain how this information is material specific to the obstetric sphere, if you will. So just very briefly, just to go over some information. So SARS, known as COVID-19 or coronavirus, is actually similar to a virus that we have encountered in the past by the name of SARS, which stands for Severe Acute Respiratory Syndrome. The risk factors for COVID-19 is for people who are over 65, people who have high-risk comorbidities like diabetes, hypertension, respiratory disease, cardiovascular disease. Pregnancy alone is not a risk factor. So if you're pregnant, you're not necessarily at greater risk of getting COVID-19. However, what we don't know conclusively is if patients who are pregnant become more severely ill if they were to get COVID-19. And so it's still very new in this process of understanding the virus, and hopefully more information will surface with respect to this question. Mother to child transmission during pregnancy is unlikely. There has been testing on the amniotic fluid, the umbilical cord blood, and breast milk, and we haven't found a significant percentage of viral particles. This, however, cannot be ruled out as information around transmission, incidence, and prevalence continues to emerge and unfold. We know that once you test positive, your positive test can remain so for about 6 weeks. We know that about 80% of people with coronavirus will have mild symptoms, and a subset of those members, or patients rather, will be asymptomatic. 14% will have mild illnesses. They'll present with pneumonia. They may require hospitalization, but not necessarily extensive hospitalization care. And then you have another 5% who will be critical and require ICU care. The latter bullets on the slide, I think, are more material with respect to the obstetric population, in that we have 2 studies, one out of Columbia, the latter out of Yale, and both of them demonstrate that we have a significant percentage of pregnant moms who are asymptomatic. We had 87.9% coming out of the Columbia study, and 73.3% coming out of the Yale study. There is, however, a difference in terms of the incidence or the number of coronavirus positive patients that they're finding, but the story from both studies is that for the most part, a lot of pregnant patients have been asymptomatic. As such, a lot of the hospitals in certainly the New York City areas in New York State and around the country have adopted screening, a universal screening of mothers once they present to the labor and delivery floor. We do ask them to wear a face mask, including during pushing, which can be difficult, but it's important. If you have a baby who's born of a mother who's considered positive, then that child is automatically considered positive and is separated from the general nursery. In terms of the studies that are available around neonates, we do have neonates who have fallen ill, and I'll leave that to the pediatricians to expand on. For the most part, those children did present with shortness of breath, but did well overall. And that was one study actually that came out of China. In terms of the mother being positive and the presumed positive status of the baby, certainly there's some question as to whether or not we should separate the mother-baby unit once delivery has occurred. There are lots of theories and opinions around that. Certainly the patient will weigh in as to whether or not that's something that is right for her. I do want to sort of round out my comments with respect to our approach to breastfeeding. people should know that it's unlikely to spread COVID-19 through breast milk. Again, the information here is limited. What we are doing in terms of breastfeeding is we are encouraging moms to breastfeed. And some of the workaround includes wearing a cloth to cover your mouth while breastfeeding, practicing hand and breast hygiene before initiating breastfeeding. And what's very important to remind women, families, is not to put anything over the baby's face. It will necessarily increase the risk of SIDS, which is sudden infant death syndrome. I will stop there and let the next presenter speak.
Excellent, and thank you so much, Dr. Nevins, for that very informative presentation. I'm wondering, might you just, somebody has background a bit there. Could you just underscore the mother-to-child transmission during pregnancy? I think a lot of people thought perhaps that could be likely, but could you just expound on the fact that that's a key point, that's highly unlikely? Is that correct?
It is correct. So it's highly unlikely. Thus far, we haven't found any evidence that during pregnancy, while the fetus is still in utero, that transmission will occur from mother to baby. Are still studies. Again, we're since January, it's now June, so we're 6 months into understanding what's going on with this virus. But thus far, that is the approach, and the management follows, that line of reasoning.
Excellent. Thank you so much for expounding upon that. And let me just say, for those of you out there in WebEx land, we certainly want to hear your comments and most importantly, your questions. And again, at the conclusion of our presentations, we will entertain questions from the chat box. So I would encourage you that as you hear the presenters, if anything comes to mind for you as we wind down, that you please make sure that you include it in the chat box. Thank you so very much. And we're going to move right along to our next speaker. And that is none other than Dr. And we're going to ask everyone to mute themselves if they're not speaking. Thank you so very much. Our next speaker is none other than Dr. Heather McGowan. She is the owner of Village Pediatric Group. She's a pediatric. She has a wonderful office in Tuckahoe. That's Tuckahoe, New York. She actually was my daughter's pediatrician and comes very, very highly recommended. She is a member of Sister to Sister International, and she's also a member of the alumni chapter of Delta Sigma Theta. So certainly a gem in our community, and we're so happy to have her talk to us this evening about COVID and the first line of defense, calling your pediatrician. What do you do? And certainly we look forward to your comments, Dr. McGowan.
Thank you, Cheryl. I'd like to thank you also for the opportunity to join this panel of esteemed presenters and address today's audience. What I would like to do today is to briefly review the signs of COVID-19 versus MIS-C in children. In addition, I would also like to go over what to expect when you visit your pediatrician's office, because obviously things have changed dramatically post-pandemic or post the onset of the pandemic. You can go to the next slide. When this pandemic began, there was not much evidence that COVID-19 behaved the same way in children as it did in adults. The symptoms that were seen in children were fever, cough, stuffy nose, runny nose, sore throat, diarrhea, vomiting, fatigue, headache, and poor appetite. In summary, the symptoms, while they are similar to adults, in children, we do not see the same brevity of the same type of symptoms. They don't react as badly. They generally have mild symptoms, and the symptoms resolve rather quickly. In the last few months, actually, multi-system inflammatory syndrome in children, or MISC, has appeared as a complication of COVID-19. The hallmark symptoms that are seen there are usually fever, which is greater than 100.4, with one or more of the following: abdominal pain, nausea, vomiting, and or diarrhea, rash, headache, red or pink eyes, red cracked lips or red tongue, red swollen hands and feet, and cough. They also have a recent history of COVID infection or exposure within the last 4 to 6 weeks prior to the onset of symptoms. These children usually present much more rapidly, and they look much sicker upon presentation. Next slide. Now, what do you do if you think your child may have MISC? Most importantly, call your pediatrician. As Cheryl mentioned earlier, we are your first line of defense. But as I said in the beginning, what happens now at the pediatrician's office is very different than what happened in the pediatrician's office prior to the onset of the pandemic. Most pediatrician's offices are offering telehealth visits as an option. So when you do call, make sure you inquire as to whether or not your doctor is offering that as an option, with the understanding that it's not ideal for every situation. And so your pediatrician may ask you to come into the office for a visit. And if that is the case, what you should expect is the following. There will be a COVID-19 pre-screening. So when you call for the appointment, you'll be asked about the diagnosis of COVID-19 for you or your child, or exposure to someone with COVID-19 in the previous 4 to 6 weeks. Current symptoms including fever, runny nose, cough, shortness of breath, vomiting, diarrhea, or loss of sense of taste or smell in either you or the child, and or a history of travel in the last 14 to 21 days. You will be asked to be timely and call upon arrival. You may be asked to wait in your vehicle or in a designated area until a room is ready for you. This is to promote social distancing and minimize patient-to-patient contact. You will be asked or will be provided with a mask for yourself and all children ages 2 years and older. Your pediatrician's office may only allow one caregiver to enter the office per child. And there will be someone who will be at the door who will probably take your temperature and your child's temperature. What's most important throughout this process is to let your doctor guide you. Don't be nervous about visiting the pediatrician's office. What we're finding is a lot of parents are afraid to come into the office. They're afraid to go to urgent care. They're afraid to go to the emergency rooms. You have to understand that everyone has taken the necessary precautions to protect you, to protect ourselves and our staff. And with that, I will turn it over to Cheryl. Thank you.
Thank you so much, Dr. McGowan. You also reinforced the importance of wearing the mask when one comes to your office as well. Could you just reinforce again the protocols that one must certainly make sure that they adhere to in terms of what they wear when they come to your office? I heard you elaborate on that previously. Perhaps you could do that again for us, please.
Right. So the recommendation is to just in general, in public, wear a mask when you're not able to social distance. When you're coming into the pediatrician's office or to any doctor's office or to any enclosed space, it's important to wear a mask to prevent transmission of particles. That is the most important reason. What's been found is that even if you are COVID positive, without a mask, there's a 17% rate of transmission of COVID versus a 3% transmission of COVID with a mask. So we do highly recommend that you wear a mask, and it is likely that you will be given a medical grade mask when you go into your pediatrician's office.
Great. Thank you so much for expounding upon that and certainly reviewing all of the key protocols related to the role of the pediatrician in diagnosing and the treatment of children. We're going to continue on our journey now. You heard from the first line of defense, and now we're going to hear a bit about tertiary care. And the presenter of this particular module is none other than Dr. Sheila M. Nolan. Certainly, she's a medical doctor, but in addition, she is the chief of the Pediatric Infectious Diseases Pediatric Hospital epidemiologist at our very own Maria Ferrari Children's Hospital at Westchester Medical Center. And she too is in academia. I tell you, we've got such a talented group of doctors here. She's the assistant professor of pediatrics right here at New York Medical College. And as I mentioned earlier, she pretty much is focused on the very sick child, the child that has what we call the MISC, or the multi-system inflammatory syndrome. So she sees the sickest of the children, and she's going to give us an overview of the protocols that she's involved with. So without any further ado, Dr. Nolan, you have the floor. Thank you.
Thanks for that lovely introduction, Cheryl, and thank you for the invitation to present in this forum with a wonderful panel. Thank you.
Thank you.
So at the medical center, since the onset of the pandemic, we've cared for more than 850 patients with COVID-19. The majority of them have been adults because, as we've discussed, it's the adults who tend to have the more severe manifestations. About 100 children have tested positive at our institution by NP swab, nasopharyngeal swab, or an antibody test. The majority of the kids who came in who were sick had a more mild or moderate presentation. We did have we've had a fair number of newborn infants who were exposed to parents or other household members and they primarily presented with fever and did very well on the whole, going home sort of rather quickly. We've had school-age children with mild respiratory symptoms. We've had a fair number of teenagers, and they tended to have more moderate illness requiring oxygen support. But as I said, the vast majority of these kids have all done very well. And then a fair proportion of our patients, it was just an incidental finding. When the numbers in the community started going up, we started screening all admissions as a protection for them and for their staff to see if anybody was harboring the virus. And so we had a lot of children who had no symptoms at all, but it did happen to have the virus detected in their swabs. We've also had a handful of children who've had what we call neurologic presentations. Some have presented with seizures, and there's a rare phenomenon called Guillain-Barré syndrome, as well as just some kids with some confusion and something called ataxia, which means they sort of wobbly when they walk. But again, the vast majority of these kids, in fact, all of these kids have really done very well, and we've been able to get them home safe to their families. So at the beginning of about mid-April to the end of April, we had our first case of the multisystem inflammatory syndrome. I think actually I should have updated this slide. I think it's 32 patients that we have now reported, these patients have had a sort of variable presentation as far as we've had some very, very severely sick kids who've rapidly presented, and then some kids with some more mild presentations. These kids, the sort of key, as Dr. Hewlett had mentioned, is that these kids have fever, and generally it's high fever for several days. We've spoken about Kawasaki disease, which I'll get into in the next slide. But abdominal pain and diarrhea are two of the things that many of these children have had as well. And then there's some more severe manifestations, which include the heart, which is called myocarditis, and then something called toxic shock syndrome, which is when kids have sort of more severe full body involvement. So Kawasaki disease is something pediatricians are all very familiar with. We've never known the actual cause of Kawasaki disease, but we've had several children present to the medical center who've had features of this illness, which again, fever, often they have a swollen lymph node, the red eyes, cracked lips, and a strawberry tongue, as well as swollen hands and feet, which you can see in the pictures here. Next slide. And then myocarditis and toxic shock are two of the more severe presentations that we've seen. The kids have often very rapid heartbeat, that's called tachycardia. And sometimes we see that heartbeat staying very elevated even when the fever comes down. Kids often get a rapid heart rate when fevers are elevated. The kids who present in what we call shock essentially means that their body is not able to continue getting good blood supply to all the organs it needs to, and the blood pressure is often very low with that. And those children have required treatment in our pediatric intensive care unit. At some point during the hospitalization, about 2/3 of the kids who have come into our hospital have been in our ICU. And fortunately, not many of them have had to be there too long, but we have had to monitor them very closely to ensure that they didn't get more sick. During the hospital evaluation, we do a lot of laboratory studies. What we're finding is, because we think this is more of an inflammatory process that happens weeks after an initial infection, they have what we call very high inflammatory markers. The COVID-19, this inflammatory process with the multisystem inflammatory disease, also seems to make kids more prone to clotting. We've seen that in the adult side as well. And we've actually had some children present with stroke, which is a very unusual thing. But again, exceedingly rare. So with the kids who've had heart involvement, we see that their cardiac enzymes can be elevated. And so the kids who have heart involvement, we study them by doing EKGs and echocardiograms. And as I said before, for those very sick kids, we send them to their intensive care unit. And kids who need, where we're concerned they need more monitoring, they also have gone to the intensive care unit. Next slide, please. So the key that we found in treating these children is that we need to reduce the inflammation in this inflammatory process that has been incited. We still don't understand with Kawasaki disease, which is similar to this, we still don't understand exactly what triggers it and what part of the immune system is controlling the severe response. But we do know that controlling the inflammation is what seems to work. And throughout many of the New York hospitals that we've been on calls with and in contact with, we're all sort of treating these children very similarly. And even in Europe and other areas of the country where they're seeing some of these cases, we use medications that reduce inflammation. Because of the concern of clotting, we also use anticoagulants, which are like blood thinners, because some of these kids, initially, we don't know whether or not they're infected with something that's causing these severe symptoms, or whether it's actually the multisystem inflammatory disease. Some of those kids get antibiotic therapy as we're trying to sort that out. And one of the keys is the supportive care, meaning if they're having trouble breathing, we support them with ventilators. If they're having trouble with their blood pressure, we give them medicines that help to do that. If they're very dehydrated, we give them fluids and support them as the inflammatory process resolves. So I think the key here is that we really do believe that this is a rare illness in children. Kawasaki disease that we've known for many years is a relatively rare disease, and so not everybody who is infected with COVID is at risk for this. Many people, and me included, are actively searching to find out what are the risk factors, which kids are likely to get this, and there's probably some underlying genetic reason that hopefully we will be able to uncover in the coming months. They can become sick quickly, and fortunately, you do have a tertiary care hospital here in your backyard, where we have a team of people who now, unfortunately, have become very expert in recognizing and identifying and treating these kids. And so, here at the Maria Freire Children's Hospital, we're happy to take care of these kids and hopefully get them home safe. We don't know long-term consequences of this illness. The kids that we've seen thus far seem to turn around actually fairly quickly, on the whole, not everyone, but so we are following these children and planning to follow them long term to understand if they are at risk for any other diseases or complications as time goes on.
Great. Thank you so much, Dr. Nolan, for that very thorough presentation. Really gave us a great helicopters overview of what happens, certainly at Maria Ferrari's and our most challenged youth. I'm just curious, you alluded to some numbers, but what would you say is the success rate? On average, children that come into the hospital, certainly with COVID and the syndrome, what percentage would you say actually have come out successfully?
So nearly 100% in all of New York State.
100%. Good.
We've had 3 deaths total in the entire United States. As Dr. Hewlett mentioned, there was one death, one in our county. But the vast majority of these kids, I think now that we are much better at recognizing the illness, and we have therapies that are working, and these kids on the whole turn around rather quickly. We've had a few kids who've needed to be in our intensive care unit for a couple of weeks, but that is the rare exception. Most of these kids have been identified rather quickly and really have seemed to respond quite well to the therapy. So we're getting a little more confident in our abilities and learning more about this illness every day.
Excellent. And thank you so much to you. So yes, we started out on our journey this evening with an overview of the pediatric population, certainly by Dr. Hewlett. You got a really good understanding of the demographics. And then we moved on and we heard an overview on mothers and newborns and the impact of COVID on that population, certainly from Dr. Nevins. And then we moved further and heard specifically about the pediatrician's role in the diagnosis and the treatment of children. I'm going to ask you to mute your phone, to mute your mic if you're not speaking. And certainly that was delivered by Dr. McGowan to really give us a good handle on the protocols related to the pediatrician's office. Then we got a wonderful overview of the tertiary care for the sickest of our children at Maria Freire Children's Hospital, certainly by Dr. Nolan. And now we're going to move on to our very final speaker, and that will be none other than Dr. Amler. She is the commissioner for the Westchester County Department of Health, and she's also a licensed pediatrician, in addition to the fact that she too is in academia. I tell you, this panel is so talented. She's an adjunct professor of public health at the Clinical Associate Professor of Pediatrics right here again at New York Medical College. And she's going to touch on some of the topics that I know are so very important to many of you. And that's related to camps and sports and how far do you let your children go? We know there are certain protocols, but where do you draw the lines? What sort of things can we do to prevent certainly COVID? But what are the kinds of things that we're doing related to reopening and contact tracing and the like? So without any further ado, we're going to hear directly from Dr. Amler, and then we're going to dive right into your questions. Dr. Amler, you have the floor.
Thank you and good afternoon. So in public health, we're really all about preventing disease rather than treating disease. And so in the last 3 or 4 months, we've unfortunately had about 34,000 cases of COVID-19 in Westchester County. And luckily today our numbers are doing much better. So instead of hundreds and hundreds of positive test results every day, we're now having about 30 to 40 positive test results a day. But we do have concerns about the possibility of a resurgence. And so we have to have measures in place to be able to deal with that should it happen. So the most important thing is to be able to identify the positive cases. And so testing is a very, very important component of that. But once we have individuals who have tested positive, then we get into the investigation phase of communicable disease management. So an individual with a positive test result will receive a call from the health department to try to understand where did they get this infection and who might they have spread it to. And so those issues are very important in being able to contain the illness. If an individual tests positive, an isolation order is issued, and we're going to talk about that a little bit more in just a few minutes. But more importantly, we want to identify their contacts. Who have they been exposed to in the time when they could have been infectious? And then, luckily now we have a bunch of individuals who are working as contact tracers to notify all those contacts of the need for them to stay at home and not expose others, and to issue a quarantine order advising these individuals how long they must remain isolated from others. Now, as you can imagine, telling people that they may have to stay home for 2 weeks means they can't go to the grocery store. They can't go pick up their prescriptions if they have it, or their dry cleaning, or whatever they need, or their children from school or daycare, if they happen to be so lucky as to have at some point that we have children in those facilities. But for right now, we have developed a wraparound service. And what we mean by that is there is a number that people are provided when the contact tracers reach out to them that they can call if they need assistance getting food, if they need assistance getting their prescriptions, or they have other needs that might force them to leave their home. And so we also continue to monitor the individuals who are both cases, known positives, and those who are contacts. The cases, we want to know, how are you doing? What kind of symptoms are you having? Are you getting better? Or are you getting worse? And if the symptoms are sufficient that they need medical attention, we would advise them how they should seek that. For the contacts, we want to know, are they well? Do they have any symptoms? And if they have symptoms, there may be the need for them to get testing. So I talked just a minute ago about the fact that an individual who tests positive is placed under an isolation order. This is an order that is issued by the Commissioner of Health of the county that the individual resides in. And basically it says that in order to prevent the spread of this disease to others, you are to remain isolated in your home. And if possible, in a bedroom or a bathroom where you will not expose even the members of your family. And they have to do this for 10 days from the onset of their symptoms. And there should be at least 3 days where they've had no fever without taking any medications. And they have to have an improvement of their symptoms before they will be released from an isolation order. Now, the period of time that a staff member who works at a nursing home must be isolated is a little different, because for these individuals, not only is there a time frame, but they actually have to have a follow-up test for COVID that is in fact negative. And so we now know that people with a positive PCR, that's a positive test for COVID, we're looking for the RNA of the virus. And the RNA, unfortunately, can stick around for a while. So these individuals may continue to test positive for weeks. We have had incidences where people have tested positive for up to 6 weeks and maybe longer. Now, if a person has a positive PCR, we would not recommend that they go the following week or even at the release of their quarantine and have that test repeated, because the chances are it's going to continue to be positive for a period of time. If an individual is asymptomatic, meaning they don't have a cough, they don't have a fever, they have no symptoms of COVID, but yet they've tested positive, their isolation period would be 10 days from the date that their test was collected. So if you're a contact, that you are not placed on isolation, it's called quarantine. And people get these terms frequently confused, and they're used almost interchangeably, but they really do have different meanings. So quarantine is when a person who has been exposed but is not yet ill is asked to separate themselves from their family and friends so that if they do develop COVID, they will not spread the disease to others. And this is extremely important, because if we can stop individuals from developing the virus and spreading it, we can stop this virus. So an exposure for a contact, if I were to call you and have a conversation around who you've been around, my major concern would be around those people in which you had been closer than 6 feet for more than 10 minutes. And that is really the definition that we look at in deciding if someone is a contact. And these individuals are required to remain in quarantine for 14 days, not from the first day they were exposed to the person, but from the last day that they were exposed to the person. So COVID testing in Westchester, we have an abundance of test sites. We have around 35 local test sites, and these are including hospitals, federally funded healthcare centers, urgent cares, some medical practices. We have some New York State testing centers where you can actually drive through, and there are a couple of even walk-up sites where you can be tested. The walk-up sites that I'm aware of, there may be others, but I'm aware of St. John's Riverside Hospital in Yonkers, Mount Vernon Neighborhood Healthcare Center on 4th Street in Mount Vernon, and the Montefiore New Rochelle Hospital. And so in those circumstances, people who don't have access, they don't have a car or any way to get to one of the other test sites, could actually make an appointment and walk into those clinics. If you think you need a test, you can go to the New York State COVID hotline, make a call there. They will ask you some questions, some exposure history questions, some symptom history questions, and help you find the most appropriate site to be tested. Or you can go to the link below, covid19screening.health.my.gov, and find a location for testing. You could also contact your local medical provider who might be able to help you get testing if needed. So once you're tested, and if your test results come back positive, somebody is going to be contacting you from the health department, as I said before, to get your contacts. And then this army of contact tracers is going to be reaching out to those people. So unfortunately, a lot of people today do not answer their phone, especially their home phone numbers. So we're asking people if on their caller ID, they see it's a COVID-19 contact tracing, please answer that phone call, because someone is trying to reach you with a very important message. They're trying to let you know that you may have been exposed to COVID and that you possibly need to be in quarantine and what those dates would look like. So very important to answer that call. So now we get to the guidance for reopening. So a lot of businesses and stuff are starting to reopen. We are having our summer camps will be opening shortly. That's the day camps. Unfortunately, the overnight camps will not be opening. Our beaches, many of our beaches have already opened. Our swimming pools are going to be opening shortly. Parks and recreational facilities also will be opening. And next week, we should be able to go into a restaurant and actually have a sit-down meal. So what are some of the things that we're advising these individuals who are going to be opening these businesses? One, it's back to the fact that everyone still will need to wear a mask. Two, that there needs to be social distancing. So especially in restaurants, they're only going to be opening with about 50% of their capacity, their seating capacity. So if you go into a restaurant, you will not be like it was before, where you're packed in there. You're going to have to be about 6 feet away from the other people that are also dining there, and that is for your protection. We also give them a lot of advice around cleaning. How can they clean the facility? And I want to remind everybody that soap and water, washing your hands, is so very important in the use of hand sanitizers. So the health department, and for businesses that are trying to reopen and have concerns, they can certainly reach out to the health department, and we're happy to help them provide them with advice to the many measures that they need to put in place to safely be able to open. Because as I said, our role as a public health department is to prevent disease from ever occurring, so we don't ever have to worry about having children in the hospital from COVID-related illness, or anyone else for that matter. And below, you can see that our website, our Facebook site, and our Twitter address. And so thank you for the opportunity to present tonight.
Wonderful. And thank you so much, Dr. Amler, for sharing such important information with us. I do have a question for you, and then we're going to go to our chat box in a lightning round to try to get in as many questions as we can for all of the presenters before we wrap up. Our scheduled wrap-up time is 7:15, but certainly we're going to maximize our time and see where we land. So with that said, Dr. Amler, I have heard this question quite a lot, and that is you have parents that want their children to get away from the computer and to get out and enjoy certainly the summer camps and all that comes along with that. In addition to, of course, it supports their mental health. As we all know, COVID has in some regards been a bit traumatic, but also at the same time, parents want to make sure that if they allow their children to participate in summer camp or any other activities, whether it's sports, that their children are safe, first and foremost safe. So what would you say to the parent that's not quite sure? Should I let my child play sports? Should I let them go to a live camp? Should I just have them participate in a virtual camp? What would be your advice?
Well, I do think social interaction is very important for all of us, including children. And the camps, we've been working very, very closely with our camps and helping them to develop policies that are going to hopefully keep everyone safe. So if a child were to go to camp, the very first thing that's going to happen is somebody's going to take their temperature. Obviously, if they have a fever, their temperature is greater than 100.4, they're not going to be allowed to come into camp that day. They're going to be told to go home and their parents have a conversation with their pediatrician or physician. They will also be asked questions about any symptoms that they may have had. So that's before you even get in the door. Once they're inside the camp, camps are going to be cohorting small groups. So there'll be a pod of like less than 10 children, and those children will remain together through the whole camp season. So instead of all the children interacting with everyone all day, they will be interacting with their pod group, which will act like a small family unit. There will not be dining in the large dining area. Again, dining will be in their pod group with 10 or more, 10 children, 10 or less children. And even swimming activities will be done with that group. And so that's to minimize the exposure to others. We have had long conversations with camps about disinfection, cleaning procedures. Most activities, virtually all activities, will be out of doors. And so a lot of measures have been put into place. A lot of thought has going into how can we make this as safe as possible. If any parents have questions about this, again, they can feel free to call us and we're happy to have that conversation.
Excellent. Thank you so much. And we're moving on to our lightning round. And we'd like to ask you, Dr. McGowan, we have a question here in the chat box. What temperature do you consider to be a fever in children?
A fever rather, in children is considered anything greater than or equal to 100.4.
Okay, so 100.4, that's the magic
That's
number.
correct. Not 99, not 90, 99.1, which is what we hear, 100.4.
Great, thank you. The next question we have in the chat box is certainly for any of the doctors that would like to answer. Are there testing statistics for both COVID and antibodies among children with MSC, with Miss C? Are there testing statistics for both COVID and antibodies among children with Miss C?
So this is Dr. Nolan. I can take that unless Dr. Hewlett, you want to jump in. So the children who we have diagnosed at the medical center, about 60% of them have had a positive test for either the antibody or the actual nasopharyngeal swab. It's about a third of the patients with the multisystem inflammatory syndrome have had a positive nasal pharyngeal swab, and the other the other third of children, there's a little overlap because some of the kids with the nasopharyngeal swabs had positive swabs, but also positive antibodies. So altogether, about 60% of the kids have had a positive test.
Thank you
And
so much.
I'll add to that in terms of there are about 1,300 children in Westchester who have tested positive. That's primarily via the nasal pharyngeal swab.
Excellent. Thank you so much. We appreciate that feedback. We do have the question, would you recommend taking temperatures daily upon entry for camps, programs, and youth centers? And I believe that was answered certainly by Dr. Amler. And I believe that the answer is yes. Would you all agree with me?
I would.
Is there anyone that would not agree with me that perhaps wants to give another perspective regarding taking temperatures daily upon entry for camps, programs, and youth centers?
I would add one thing to that, and that is that although temperature is is something we can measure, it's not subjective. We actually can measure that. But people do need to remember that there are asymptomatic cases, and not everyone with COVID will have a temperature. So it's not 100%, but it is something that we can measure. And so that's why it is done. So it might help you, identify some individuals who are ill. It will not identify all individuals who are ill.
Excellent. Thank you so much for adding that bit of clarity. Next question. There are individuals who had Miss C who are not part of the stats because they weren't treated in the hospitals. Is anyone collecting that information? And should the county be collecting that info? Individuals who have had Miss C who are not part of the stats because they weren't treated in the hospitals. Is anybody collecting that info?
I can say something about that, and maybe Dr. Nolan might want to say a little bit more, but to the best of our knowledge, the children who are residents of Westchester County who have met the definition for the syndrome have actually been counted. We've even included children who have been treated in hospitals outside of Westchester, to the best of our knowledge. There may be children that we don't know about yet, but we actually obtain information from other jurisdictions, and they actually share the information with us so that we can capture those in our records.
Excellent. Thank you so much. And let me just shout out that for all of you that are participating, certainly we are on Facebook Live. We are live, so please send us a reaction if you can. We're delighted to be on Facebook Live at this point in time. Westchester County Youth Bureau. Next question in our lightning round here is, what are some precautions that children will need to take who attend a summer camp? What are the precautions that the camps must take in terms of social distancing? And certainly, Dr. Amler, I know you touched on some of these. I don't know if there's anything that you want to quickly amplify, and then certainly we'll move right along.
I think the main thing about social distancing is that the kids are going to be, as I said, in a group of about 10 children. So they will certainly interact with the children in their group, but that group will be consistent. And so will almost function like a family unit. But they will be kept distant from other groups. So the groups will not interact. So in that way, you are limiting exposure to the best of our abilities and still having children participate in a camp-like experience.
Thank you so much. And let me ask you this, certainly Dr. Amler and team, what about the pools? There's a lot of hesitancy and people are not quite sure how to proceed as it relates to the pools. We know they're opening. What's the story there?
Well, again, the number of individuals who are going to be allowed into pools is dramatically reduced. And children and adults will, again, will be asked not to congregate in large groups, to remain with no more than 10 people in an area. That, I guess I could understand why people might be a little concerned about that, but I think that's the best that you can do in a swimming pool situation. But certainly the numbers are going to be dramatically reduced. And so I guess it's up to the parents to take a look at the pool, see how comfortable they feel with the circumstance there. And again, we're always here if they have questions around it.
Okay, great. And we have one other question. Once in phases 3 and 4, can children social less than 6 feet apart if they wear masks and practice good hygiene? So once we get into phases 3 and 4, can children social distance less than 6 feet apart if they wear masks and practice good hygiene?
I think it's going to depend on the circumstance. I don't have an exact answer for that, and I'm sure that guidance will be coming from the state around this. But unfortunately, I don't know. I don't know if any of the other panelists know, but I think it's going to depend on where they are as to how much restrictions are going to be in place, no matter which phase we're in.
Okay, thank you for that. We have one other question in the chat box, and then certainly I'm going to ask Dr. Damia to give guidance on where we go from here. We're certainly happy for all of the wonderful presentations. It's now 7:18, and the question that we have here is, I work in early intervention, home-based, and what protocol and procedures have been implemented in respect to social distancing in the homes and/or daycare centers?
Well, at the current time, early intervention is not in session. And so I don't have the exact answer for those, but certainly if the individual who had that question wants to email me, I will try to get an answer for them.
Excellent. So we don't have an answer right now. We are aware of the question, and we're asking you to email Dr. Amler, and she's happy to be in touch with you to work with you more closely to get an answer. Okay, so that said, we want to thank you all for participating. I'm going to turn it over to Dr. Damia Harris. I think that certainly we have had a wonderful journey this evening, and I want to give my personal thanks to all of the doctors who really went the extra mile and I think did a great job as a team. So again, it's been my pleasure to serve as your moderator. And it's now also my extreme pleasure to turn it back over to none other than Dr. Damia Harris, who's doing a fabulous job at the Westchester County Youth Bureau. And she is going to close us out for the evening. Thank you very much. And Dr. Damia, you have the floor.
Thank you, Cheryl. What a wonderful job. I mean, you've taken the idea and really made it come to life. You, along with Kate Sugg, as well as Susan Weissman, have been tremendous. But I really want to express my deepest and sincerest thanks to the medical professionals that sprung into action. This is the second time that we've offered this. The first, we had over 100 participants on WebEx. And again, tonight we had over 100. And we experimented and went Facebook Live. And so we want to actually make this video available through YouTube so that people who were not able to tune in tonight, because we're in a Zoom situation where people are jumping from one Zoom and one WebEx to the next, they will be afforded the opportunity to actually listen and hear from our medical experts. Again, Dr. Nolan, Dr. Hewlett, Dr. McGowan, Dr. Nevins, Doctors Amler, of course, who is like my go-to. I call her and she's like, Damia, call your own physician, I'm sure, but she's always willing to answer a question. And so I really thank her for that. And we were very grateful to have the county executive join us early on. And it's really important that the community sees the work that we are doing collectively. We are not just limited to, positive youth development service providers, but also to medical professionals, also to parent organizations such as Jack and Jill, and sororities, fraternities, community and civic organizations as well that have joined us tonight. Part two will be coming, and that's to address the mental health of our children and youth, because we know that this is a unprecedented time, and we have a number of talks concerning, the toxicity in the environment, but also just the barrage and deluge of emotions that we all feel concerning the civic or civil unrest that we're experiencing. I can speak firsthand to say that my mental health is probably not at its best, and that also impacts our physical health. And so as adults and professionals, if we're challenged by these times, imagine what our young people and our children are experiencing. I talk about this quite frequently as I have small children in the home. The most difficult job was not, running some statistical tests. It's more explaining the ABCs of racism to my 4-year-old who is, aware that there are troubling times, and my 6-year-old who sees mommy crying. And so we cannot talk about the physical elements that impact our young people without talking about the psychological and mental manifestations of these things. So again, we hope that we'll be able to, call on our doctors in the future to join us should we see a surge, hopefully not in September, but we also invite those that are listening and that are involved tonight to join us once we have a second round pertaining to the mental health of our children and youth. With that said, I want to thank you all for staying a little bit longer. I hope that you all enjoyed this session as I did, and based on the responses on Facebook and also in the chat room, people really appreciate the work that you are all doing. You are first responders and are on the front lines and are taking care of our most vulnerable, and that is children. We have the elderly and our children, right? So we thank you immensely on behalf of Westchester County, as well as the community and participants tonight. Thanks again. Kate, did you want to unmute if the doctors wanted to say goodnight or have any comments?
Yep, I'm going to unmute all of the doctors if they would like to make any comments.
Thanks for having me. This was really nice.
Thank you for involving us, and I volunteered to help you with any of the questions that couldn't be answered, because I think there may be some important questions people have that there might be groups of questions that we can send out answers to.
Thank you, Dr. Hewlett. We will do that. We will
It might be
information.
It might be that we could use them for a Q&A to put on our website because I think the questions that people have probably are not unique to them. And so Dal and I can work together with our health education and department and see if we can get some of that up on our website.
Thank you. We appreciate that.
Yeah. And I just want to say this was a wonderful idea and a wonderful program. You know, the question of to camp or not to camp is certainly one that we all share, including myself, in terms of deliberating whether I should, you know, hold my son close or send him out to camp, given the isolation that, you know, he and other children have had to sort of suffer through, for lack of a better term, over the last 3 months. So this was very informative. It provided some information that necessarily isn't a sure one that it's going to be okay to send them to camp. But at the very least, you know, you have given us the information that we need to make informed decision about our children. So thank you all. I appreciate it.
Thank you.
Dr. McGowan, there was a comment on Facebook. There was apparently a former patient of yours who wants you back. So I don't know what that means, but she says she misses you and she wants you back. This is actually from
Aw.
Maria on Facebook. So again, if you want to check out Facebook Live, you know, it will be present on the Youth Bureau's page, Westchester County Youth Bureau. Feel free to drop in a comment, like what you see, and we hope to be in touch soon. Thank you.
Thank you.
And Damien, thank you for your leadership in this, because as a pediatrician, I think our youth are the best part of our country.
Thank you. Absolutely. We're the youth champions at the Westchester County Youth Bureau, the whole team, as exhausted as we all are, and we recognize how tirelessly the Department of Health is working, and we thank you as well.
It's our pleasure. So thank you and good night.
Okay, good night.
Everyone have a great night. Thank you so much for joining us.
Thank you, Kate. Couldn't do without you.
Thank you. Good night.
Thank you. Good night.
Night.
Good night.
Night
You
to our
guys were marvelous.
participants.
Thank you so much.